In a previous conversation, you'd mentioned that you guys are starting to kind of look at smart rooms. What's the value proposition of smart rooms? Why should health systems, be looking into smart rooms?
Yeah, great question. I think technology is a tricky one sometimes when you're looking at ROI, and there's some squishy stuff that comes along with that. And so one thing I'll try to be very real with our E-team about is that it may be technology for the sake of the fact that we have to have the technology, right? And that's kind of where electronic medical records came along, or even like TVs in rooms. There's not an ROI that there's a TV in a room, right? But it also, you have to have it. Like, this is where we're at, an expectation that patients have. And so I don't believe that it's technology for the sake of technology by any means, but I also don't like to. I was a consultant for a while, so I'm all about not over promising and under delivering by any stretch. And so I just said it could be that, but here are the ROI metrics that we're looking for, and thinking about digitally enabled rooms as a large scale solution, not solving for one thing. So we're not doing this just for virtual nursing or just for sitters. Right. It has to be an all encompassing look at this. And that's where you start to see a lot more of the ROI for the technology, because otherwise I would never be able to do it just for virtual nursing. The math is not going to math on that. But when you start to add on some other capabilities and think about patient experience, can you bring visitors into the room, right? So people don't have to leave work, but they can hear what the hospitalist is saying. When you think about from a nursing perspective, giving nurses the opportunity to do their job virtually and not on their feet all day, there's some retention there. And so those are going to be some tricky metrics, I think, to track, but we're committed to doing that as we're on this journey. And we've got an amazing foundation at Novant Health that loves to help us get started in some of these initiatives. And so we're hopeful that'll kind of work out to get us a kickstart, so my team and I can really look at some of these metrics of like baseline, where we're going, and then are we getting what we think we're going to get out of this.